This is Medical Monday on eRadio, and joining us again today is Dr. Clifford Yudelman from OptiSmile. Today talking about the link between oral health and overall health. Dr. Yudelman, welcome back.
Thanks so much for having me on again. After last week's episode on general dentistry and preventive care, and then our Valentine's one about bad breath. So today is actually the one that I've been waiting for the most. And because a lot of people, they don't care so much if they lose another tooth or if they have a bit of bad breath or their gums are bleeding, and they're not that interested in oral health. Maybe it's something that they learned from their parents, like, it's just a tooth, pull it out. So I'm not going to argue or try and change someone's mind, but hopefully today's episode will make people think twice about what's going on in their mouth. So I hope you got some good questions for me, and I'm going to stay on track today and answer your questions. So thanks very much.
Absolutely. How can oral health impact your overall health and well-being?
That's a fantastic question, because your oral health can really affect risk of heart disease and stroke. I'll get into the mechanism because some of these things are all very similar. Diabetes and controlling your blood sugar and pregnancy. And now they're even talking about things like Alzheimer's and mental health. 10, 20 years ago, there were indications that this was the case, and there were quotes from the Mayo Clinic that people with their natural teeth, live 10 years longer than people that don't have their natural teeth, and so on. But it's really in the last 5-10 years that there's just study after study after study that link your oral health directly with these things that we just spoke about. I think we can maybe carry on and you can ask me specifically about each of these.
What are some systemic diseases linked to poor oral health?
Okay, so let's start off with one that you can't argue with, and that is these days diabetes, especially in the US, but I believe in South Africa as well. Type 2 diabetes is an epidemic. We eat way too many carbs, me included. Although some people think Professor Tim Noakes is controversial, I can say from a personal point of view, 2 years ago, I was pre-diabetic. I was on diabetic medication, and I felt ill from the medication, and I discovered Tim Noakes' videos, and I did some banting for 2 months. I lost 16 kilograms. And I went off all medications, including blood pressure medication and diabetes medication and cholesterol medication. So I think there's some things out there that can help people who've got type 2 diabetes rather than medication. And one of the things is brushing and flossing and going to the dentist and making sure that your teeth and gums are healthy, because they've shown without any doubt that when your gums are bleeding and you've got gum disease, your blood sugar will be almost impossible to control, and vice versa. If you've got diabetes, you're more prone to things like skin infections and gum infections. So diabetes, I think we've got that covered, and you can just Google it. You'll see there's study after study after study. The other one is heart disease. So interestingly, when someone gets a bypass and they remove a clogged artery from your heart, the cholesterol buildup in that layer in the wall of the artery, they send it for genetic testing. And it's only since we've been doing all this genome stuff the last 10, 20 years, they can also do a scraping of your particular flora. There's 8 main bacteria in your mouth that are responsible for gum disease. And in each of those, they've got long names. I won't mention them here and try and show off to other dentists, but they've got abbreviations like AA. Actually, let me tell you, that's actinomycetans, comitans. That's one word, two words, AA.
Wow.
So if you've got AA in your gums, there's different genotypes of AA. And so maybe there's like 50 different types of this particular one. And if they do a DNA test of the little bit of your artery that they remove from your heart after a heart attack, they will actually find the DNA of that bacteria that's in your mouth, in your heart. So that was last time I checked. I haven't read any further papers in more recently, but there's hundreds of other papers about how oral health causes heart disease. And now there's also about Alzheimer's. I think people must actually look after their health and Google this stuff. I use Perplexity, or I go to scholar.google, and you find things that are in medical journals. Don't believe everything you see on the internet on a regular website. You can go to something like Mayo Clinic, heart disease, gum disease, and you'll probably find something more reliable.
And then I'm sure the WebMD website will obviously say something again that will make you believe 100% that you are busy dying, because that's what they do with that website most of the time.
Yes. Oh, and the other thing is osteoporosis. So it's very important that especially in females or even in males that cycle, if you don't do any load-bearing exercise and you just cycle every day and you don't actually get any upper body exercise, it's a big risk for osteoporosis, especially as you get into your 60s. And then people who have osteoporosis go on this medication. It's called the type of medication is bisphosphonate. I don't actually know all of the different drug names, but once you go on that, you can never get a dental extraction. So you have to make sure that you don't get osteoporosis in the first place. And there's a lot of information out there how to avoid it. It is pretty much avoidable. Hormone replacement in women is controversial in South Africa, but it's something definitely to look into. It's not just about the hot flashes. The hormone replacement will actually protect your bones. I've been very interested in this recently because I get a lot of female patients that are on these bisphosphonates, and so I've really looked into it. And you can't get a dental implant if you've got osteoporosis. And yeah, your bone health is very important, and it can affect what goes on in your mouth. So that's just going the opposite direction.
Doctor, what are the signs that your oral health is actually busy affecting your general health? Do we get symptoms? How do we know?
Let's put cavities aside. Well, actually, let's talk about cavities. If you got cavities between the teeth, and when you're eating, food gets stuck and you can't eat your protein, you can't eat your fish or your meat or your veg, your carrots are getting stuck, and you just eat a lot of mushy, like mashed potatoes and a lot of carbs, crisps and chips. Your diet is affected by how you're able to chew and bite. If you're missing a lot of teeth, or maybe you've got loose dentures, you've lost your teeth. And we know that diet is very much related to our systemic health. So that's from a point of view of cavities. They're getting teeth fixed early before the cavities go into the nerve. Once a cavity goes into the nerve, you can get an abscess in the bone. You can get a severe infection. It can cause fevers, swelling, pain. I think people listening to this have maybe had those problems before, and it can actually give you flu-like symptoms, and it can cause quite a bad infection. But I think your question maybe has more to do with how do we even know? These are the obvious things that we want to avoid. But what about just someone with bad breath? If you've got bad breath, if your wife or husband tells you you've got bad breath, or maybe your kids, something to do, if you listen to our Valentine's Day podcast, is you look at the back of your tongue. If there's a lot of tongue coating, you go out and you buy some dental floss and a tongue scraper. You scrape your tongue. When you floss or you brush, if you see it's called pink toothbrush, you brush your teeth without toothpaste for a minute with a dry toothbrush and spit in the basin. If you see blood, that's bacteria that are living under your gum line, and they are going into your bloodstream and they're going to your heart. They're going to cause high cholesterol. I mean, I'm sounding quite alarmist, but I mean, this is the case. And if you've got other health issues, those bacteria going into your bloodstream are not going to help your heart or your brain or any other part of your body. Having really good oral hygiene is very important. I think, back to the bad breath or the bleeding gums, that's key.
So, doctor, if I'm on medications currently, how would I know it's affecting my oral health?
So, and that's a really good question. I'm so pleased that you asked that, because come to the dentist and they wonder why we delve into their medical history. And I think, we've covered some of the things. If someone's already knows they have diabetes, or they know they have heart disease or high blood pressure, we know that we can motivate them to improve their oral hygiene. But knowing what medications you or a patient that's coming to me today or tomorrow is on, it really helps us, because so many medications, if you Google dry mouth, the technical term is xero, like a Xerox, xerostomia, STOMIA, or just medication and dry mouth. There's a list of literally maybe 200 medications. The common ones would be any some of the psychiatric medications, some medications for like antihistamines. There are a lot of medications that dry your mouth. And when you've got a dry mouth, the acid is going to attack your teeth more. You're going to get more erosion. You're going to get more cavities, and it's going to be difficult to eat and speak. And if you do suffer from a dry mouth, we could actually do a whole episode about dry mouth. That's another systemic condition. It's generally caused by medications. There are things like arthritis in people with rheumatoid arthritis, where the arthritis also knocks out the salivary glands and also your tears, and you have very dry eyes or dry mouth, or radiation treatment that's caused dry mouth. But also people that have gone through a bout of depression, and depression is not something to be embarrassed about. People should reach out for help if they have thoughts of suicide, or they're depressed, or they have no one to speak to. I know it's a bit off subject, but if someone is depressed, they don't brush, they don't floss, they don't care about their oral health. And people can go through this period of neglect, and then there's some embarrassment about the damage that's been done, and it's a bit of a vicious cycle. And I think I've gone off subject there, but I just wanted to get that across, because it's I think it fits into this episode, how your general health can actually affect your mouth. And also, as people get older, or if you've had an injury, or if someone's got some kind of paraplegia, or you need a carer to help you brush your teeth, not being able to actually physically brush or floss is another thing. So there are things where medications and or systemic problems can cause oral problems, and your dentist is the best person to help you with this. And I think at this point, I should say that anything I'm saying here, any advice, it's not advice, it's general information. And you should always check with your dentist. If your dentist says Dr. Yudelman doesn't know what he's talking about, I'm fine with that. Go and Google it, or ask your dentist for advice. Please don't follow everything I'm telling you here blindly.
Doctor, I never realized how important it is for dental care, especially during pregnancy, and oral health, and how they interconnect. Why is dental care so important during pregnancy?
So, Ian, I'm so pleased you asked that, because I clean forgot to actually mention that earlier in that, because we don't think of pregnancy as sort of part of systemic health. It's a natural thing, and we think our bodies know what to do. And we don't think of it like heart disease and diabetes, but yet there's many studies that have shown that in a lady, in a female who is pregnant, that has severe gum infections and poor oral health, and of course, if you've got cavities and, like I mentioned earlier, poor diet because of your problems with not being able to eat the correct diet that's good for the kid. You could have a malnourished baby or so on. But the main thing is gum disease has been proved to be one of the causes of preterm deliveries. And if a baby is born a week or 2 or 3 weeks early, it causes a lifetime of problems, or it can take a long time before the baby is healthy. Sometimes the baby has to go into an incubator. And so getting your mouth nice and healthy is not only good for your relationship, but it's also good for your baby. And drinking alcohol during pregnancy or smoking during pregnancy, I think most people know about that. If you go and you're drinking and you're showing like 6 months pregnancy and you're smoking, I think every other person is going to come up to you and wag their finger in your face and say you're harming your baby. But who's going to tell you about flossing and brushing?
True. And then lastly, our final question for today. How does stress affect oral health? And let's look at some of the strategies to reduce its impact on our dental well-being.
Okay, so that's a fantastic question, because I mentioned a little bit about depression and psychiatric or psychological problems. And some people are very tough and they're able to withstand a huge amount of pressure, whether it's financial pressure or relationship pressure or teenagers acting up. And they're very good at, one thing is, they say biting your tongue and not actually reaching out or lashing out, but it comes across as grinding. A lot of people we find grind their teeth at work or during the day as well as at night. And so there are exercises one can do. Meditation, yoga, walking, all things to reduce stress is very important. But in some patients, they've developed their muscles really well and they become professional grinders, and people grind away their teeth. This is on top of any kind of acid erosion, or they keep cracking. You put a filling in and they crack the tooth, and then you put a crown in and they crack the crown. And there are things we can make for patients called night guards, like a piece of plastic that you wear over your teeth. I find that people don't wear them unless they've got jaw problems. So grinding your teeth stress can cause TMJ, which is your temporomandibular joint. It's just a long word for that joint there near your ear. If you're getting headaches, earaches, things like that, you go to the ENT because you think you've got an ear infection. Your dentist is the right person to consult. And personally, I don't make a night guard or a bite guard for a patient that's grinding unless I also question them about snoring and sleep apnea, because so many people, if you've had extractions for orthodontics, if you've got a small mouth and a big tongue, if you're overweight, or if you've got a large neck or other risk factors for sleep apnea, if you wake up with bruised ribs because your husband or wife keeps hitting you in the ribs every time you snore, that's a sign of sleep apnea and snoring. There's an app called Snore Lab where you can record any sounds that you're making at night, and the snoring, it sounds like an aeroplane, and then you'll hear yourself choking and coughing. And then after that, you're very quiet, because then you're cracking your teeth, you're grinding your teeth like crazy. And so just giving someone a night guard for grinding, you might actually be making the sleep apnea worse. So I send all my patients for a home sleep study. It used to be that medical aid covers it. I don't know if they cover it. It's about 2,000 Rand. You do not have to go and have a hospital sleep study. A home sleep study where you take home a special machine and then you bring it back. You go to a sleep. You don't necessarily need, most dentists won't be able to help you with a sleep study. But if you're grinding your teeth and this sounds like you, then please get it checked out, because if you think gum disease affects your heart disease and your diabetes and your psychiatric and all of that, sleep apnea is way worse, and it's tied into the gum disease and everything we've spoken about. We could actually do an episode just on sleep apnea, maybe in a month or two.
Looking forward to that. As always, amazing advice, Dr. Yudelman. Thank you so much for your time. Just to ask quickly, how do we get in touch with you, and also your website and your socials?
So it's OptiSmile, OptiSmile. We call it OptiSmile because we optimize your oral health and we optimize your confidence. We enable you to smile with confidence and vitality. That's how we came up with OptiSmile. You go optismile.coza. You can WhatsApp us from there. You can phone us from there. I won't repeat my phone number or my WhatsApp number. You can just Google OptiSmile or Google Best Dentist in Cape Town, and hopefully we show up somewhere in the first page. I'm not saying we are the best dentist, but we've got over 310 5-star reviews. Read our reviews and see if it's something where we can help you. We're in C-Point, and we also offer free video consultations for patients that are intending to actually come to C-Point, and they can book it. You have to fill in, there's a health history and a dental history that you have to fill in before we actually set up that half an hour appointment for you, and we're able to give you all kinds of personalized advice. At that point, it is personal advice, and even though we don't charge, it is considered a doctor-patient relationship. And for anyone that's thinking about coming to see us, and you're coming from far away, I would encourage you to book a video consult just straight from our website where it says book online. It's one of the first options when you go into that under new patient.
That's a very great initiative there, Doctor. Thank you so much, as always, and until next week.
Thank you so much, Ian. It's fantastic. Bye.